Mental health and its impact on men's sexual life. Mental health conditions such as stress and anxiety can have a profound impact on male sexual health. These psychological factors are often significant contributors to sexual dysfunction, including erectile dysfunction, ED, premature ejaculation, and reduced libido. Understanding the relationship between mental health and sexual function is essential for effective management and treatment. The impact of stress and anxiety on male sexual function. Stress and anxiety disrupt the body's natural physiological processes required for healthy sexual function. Elevated levels of cortisol, a hormone released in response to stress, can interfere with the mechanisms that regulate sexual arousal and performance. Erectile dysfunction is commonly linked to psychological stress. When anxiety interferes with the brain's ability to send signals to the reproductive system, it may result in difficulty achieving or maintaining an erection. Similarly, premature ejaculation may occur due to heightened anxiety, as the body enters a state of increased arousal and sensitivity, leading to reduced control over ejaculation. In addition, chronic stress can suppress sexual desire. Mental fatigue, emotional tension, and persistent worry often lead to a decreased interest in sexual activity. This reduction in libido can further strain intimate relationships and contribute to emotional distress. The cycle of anxiety and sexual dysfunction. Performance anxiety is a well-documented phenomenon that can create a self-perpetuating cycle of sexual difficulties. Concerns about sexual performance may lead to episodes of ED or premature ejaculation. These experiences often increase anxiety regarding future sexual encounters, thereby reinforcing the cycle of dysfunction. Over time, the persistent presence of stress and anxiety related to sexual performance can lead to avoidance behaviors, reduced intimacy, and relationship challenges. The psychological burden associated with these conditions can significantly affect overall well-being and quality of life. Strategies for management and intervention. Managing stress and anxiety-related sexual dysfunction requires a multifaceted approach that addresses both the psychological and physiological components of the condition. First, identifying and addressing the underlying causes of stress and anxiety is essential. Therapeutic interventions, including cognitive behavioral therapy, CBT, stress management techniques, and, when appropriate, pharmacological treatment, can be beneficial. Second, shifting the focus from performance outcomes to the experience of intimacy and emotional connection may alleviate performance pressure. This approach encourages individuals to engage in sexual activity without the expectation of perfection, reducing anxiety and enhancing satisfaction. Open communication with a partner is also critical. Discussing concerns, fears, and expectations can foster mutual understanding and strengthen the emotional bond between partners, thereby improving intimacy. Finally, seeking professional help from a healthcare provider or a therapist specializing in sexual health is recommended for individuals experiencing persistent or distressing sexual dysfunction. Professional guidance can provide tailored treatment strategies and support the development of coping skills. Conclusion. Stress and anxiety are significant factors influencing male sexual health. Their impact extends beyond the physical aspects of sexual function to affect emotional well-being and interpersonal relationships. With appropriate intervention, including psychological support, communication, and medical guidance, it is possible to effectively manage these challenges and restore healthy sexual function.